Good afternoon, everyone. My name is Kim Stevenson, Director of Workforce and Clinical Affairs at the Massachusetts Health and Hospital Association. I want to welcome you to today's webinar, Who Me? Stress First Aid, Key Concepts, Skills, and Impact. A few logistics before we start. If you have questions during the webinar, please enter them into the chat feature as we are in listen-only mode. The questions will come directly to us and we will do our best to address as many as we can at the end of the presentation. I also want to take a moment now to thank MHA's 2024 sponsors for their support in underwriting today's webinar, which is just one of many events we have to offer throughout the year to connect our members with leading experts to help address timely issues like the one today. I'm pleased to introduce our presenter for today's webinar, Dr. Beth Sloan, Chief Medical Officer at the Schwartz Center for Compassionate Healthcare and Associate Professor of Medicine at Harvard Medical School. The Schwartz Center for Compassionate Healthcare is a nonprofit dedicated to strengthening the relationships among patients, families, and clinicians and advancing compassionate healthcare. Dr. Sloan has also served as president and board member of the American Academy on Communication and Healthcare. Additionally, she is the director of faculty development at Mount Auburn Hospital. She has co-led several fellowships in medical education for faculty within the Harvard Medical School system and is the director of the only longitudinal interprofessional fellowship in health professional education in that system. Thank you all for being here today. And Dr. Sloan, I'd like to hand it over to you now.
Well, thank you very much, Kim, and thanks to all of you for joining us today. I'm going to share my screen here. So if you give me a minute, it should load. And there we go. Everybody okay to see? I hope. Well, thanks for the kind invitation. As part of this caregiving series, I've been asked to speak about stress first aid, which is one of many programs that we offer at the Schwartz Center for Compassionate Healthcare. We launched this in June of 2020 when it became obvious to us that the healthcare workforce was being endangered, not just by the pandemic, but also by the very real possibility of a mental health pandemic as well. So my hopes for this session are to describe some of the common sources and the impacts of stress, and then I'll describe some of the key components of our stress first aid program, including the stress continuum, the key factors and the core actions of stress first aid. And at the end, we'll have some time to go through some cases, which should be fun. For those of you who don't know about the Schwartz Center, we are a national organization with international programs, and our mission is to sustain compassion at the heart of healthcare, which we do through our programs, education, and advocacy, so that healthcare workers are well enough to be able to provide care that is compassionate, safe, effective, and equitable. And our programs, particularly our Schwartz Rounds program, which is our signature program, it's offered in more than 600 healthcare organizations across 44 states and also in Canada, Australia, New Zealand. And we work with a partner in the United Kingdom who trains their folks to operate and conduct Schwartz Rounds in the United Kingdom and in Ireland. So let's talk now a little bit about some of the common sources and the impacts of stress. And of course, you know that well before burnout, that burnout was happening well before the pandemic hit us. And there's so many contextual issues that really contribute to this, this problem, ranging from problems in the workplace and the learning environment, including cultures and organizations that don't prioritize health worker well-being, long-standing bias and discrimination, now increasing violence and harassment in our workplaces. There are certainly organizational factors, lack of leadership support, lack of autonomy, exclusion from some of the key decisions that affect our work, and emphasis on productivity over sometimes patients and the healthcare workers' needs. And the health system itself, of course, is really fragmented. There are barriers both to access to care and quality of care. And all of this is nested inside the larger social context that sometimes has unrealistic expectations of us and is rife with politicization of science and polarization. So we have our work cut out for us. And if you haven't visited the website of the Office of the U.S. Surgeon General, I suggest you do so because his framework is really very, very helpful. The important point here, though, is that burnout is not a personal failing. It's not a a problem with the individual. It's an occupational syndrome that results from an imbalance between organizational demands and resources and between effort and rewards. The demands on clinicians erode the amount of time that we have to spend with patients and with our families. And all of these are compounded and really result in the degradation of clinician-patient relationships, which is really the reason why we went into healthcare in the first place. And that is what drives our sense of meaning and purpose. On the other side of the spectrum, we have this meaning and purpose in work. We have a sense of being resourced and well-resourced when we experience that. And when also the values of organizational culture are aligned with ours. We feel a lot better when we have some flexibility, autonomy, and control over our jobs. And we'll talk about the role of professional relationships and social support. Recognition and appreciation by leaders and peers is also extremely important as a resource, as is work-life integration or balance. So how are we doing? Well, the Centers for Disease Control and Prevention issued a report card, in a way, on healthcare worker mental health and work-life integration, comparing surveys done with representative samples of the population in 2018 compared with 2022. And what we can see there, and this was published in MMWR recently, not too long ago, 2023, was that the days of poor mental health reported by respondents during the preceding days increased in 2022 compared with 2018 to 4.5 days. Experiencing burnout often or very often increased, 45.6 days. Likelihood of looking for a new job increased in 22. 44%. This is really worrisome given the staff shortages that we're facing and the lack of really robust pipelines in many of the health professions. Reports of harassment doubled, going from 6.4 to 13.4%. And among the health workers that reported harassment, the odds of reporting anxiety, depression, and burnout were significantly greater compared with those who didn't report such episodes. Trust in management decreased, and agreeing with the statement that workplace supports my productivity really was basically cut in half. So in summary, things are not good in this report card. This is from another study by Linda Aiken, a very well-respected nurse researcher. She did a very large study, about a little over 20,000 people, physicians and nurses at 60 magnet hospitals across the US. And she found that 43% of physicians and 53% of nurses reported a great deal of job-related stress. Worrisome also are these statistics from the Physicians Foundation, which really shows the extent to which our medical students and our residents, our trainees, are suffering. What they found was that 53% of students and residents were self-medicating, alcohol, illicit drugs, increased use of medications, and a full 43% had either thoughts or demonstrated actions of self-harm. And this really should be a clarion call to all of us. This did not look at nurses. We need such a nurse study as well. So what is it that happens exactly when we're experiencing these high levels of stress? Well, different brain networks interpret environmental or social signals as real or potential threats. And that's when, of course, the stress response kicks in. The stress response it's an adaptive physiological response to improve performance and to deal with immediate threat. The amygdala and related connections, they rev up the sympathetic nervous system for fight or flight. And the neuroendocrine system tells the adrenal glands to secrete more cortisol. So the stress response by means of various mediator molecules promotes short and long-term alterations in cellular excitability, as well as in neuronal and synaptic plasticity, which leads to transient, but can also lead sometimes to permanent changes in physiology and in behaviors, which can in turn then lead to or contribute to significant mental and physical health conditions. So what helps? Well, I want to highlight the importance of social connection and social support. This was really a very, very important study by Julia Holt-Lundstedt that was published a while back, but it really shows that social support and being socially connected is so incredibly important across measurement approaches, across gender, age, country of origin. People who are less socially connected are at greater risk for early mortality. And the effects of these social relationships can be benchmarked against other very well-established lifestyle risk factors. But you can see in this figure from her article, the magnitude of the effect of social connection on mortality and risk is comparable, and in some cases, it exceeds that of other very well-accepted risk factors like smoking, alcohol consumption, and the like. So let's now refocus on stress first aid. What is it? What are the key factors and the core actions that actually comprise this model? The Schwartz Center has two main programs in stress first aid. There's a basics version, which is available to anyone who is employed by an organization that is a member of the Schwartz Center. If you're not sure, you can go onto our website and send us a message. And there's also a train the trainer version. The key tools in the stress first aid toolbox that we help people with include the stress continuum, the key factors, and core actions. I'm going to go into all of that in a minute. What is stress first aid? It is a self-care and peer support model. It was first developed by the military, actually for the Marines and the Navy to improve recovery from stress reactions. And as I mentioned, it includes for us, we've chosen to highlight the stress continuum, 5 key factors and 2 core actions. This program can reduce stigma. It really must reduce stigma, change culture by normalizing the need to reach out for help. It really creates a common language to be able to recognize and address stress reactions before they can really create significant problems. The program emphasizes flexibility and tiny little small steps, things that you can actually do, at least in the short term. Important point. This is not counseling and it is not therapy. It emphasizes the need to bridge to higher levels of care when that is needed. So why bother implementing this? Again, you've seen the stats, so it's a little bit self-evident, but the goals are really to reduce the risk of stress injury among health workers, affecting sense of purpose, unit cohesion, to decrease stress injuries that can potentially impact care experiences, quality, safety, to reduce chronic stress and the correlated chronic health conditions that occur when these persist, and also to reduce absenteeism and presenteeism due to disaffected, burned out, disengaged people on the workforce. So let's dig into these tools. So this is our stress continuum. And it provides a really cool, very quick way of visualizing and talking about stress. You'll notice that the colors are a gradient. They blend into each other because we often move from one color zone to the next within the course of the day, even within the course of a single interaction. And it's important to know that we don't just let it suddenly tip over from one into the next. The color green represents thriving, at your best, feeling okay, well prepared, feeling competent. Yellow represents reacting to some stress, which honestly is probably where most of us live in healthcare on the day-to-day. But, whatever stress reactions we have in this zone, usually they're transient and they don't stick around for very long. You're able to resolve them. They don't persist. The orange zone represents struggling, and the stress reactions in this zone are a little bit more significant. In fact, they actually may leave a scar if they continue. And then there's the red zone, which signifies that we're actually really unwell, either due to an unhealed stress injury or because the unhealed stress injury has left some permanent impairment. Also, it includes feeling unwell because of clinical disorders, PTSD, substance use disorder, anxiety, depression, all of which sometimes are correlated with stress, as we've shown. I want to go into the orange zone, the struggling zone, a little bit more, because this is the zone we want to focus on we want to really try to identify people in this zone so we can pay attention and intervene if need be, so we can prevent further evolution of the stress reaction. So these warning signs of excessive stress that you can learn to look out for are cognitive, feeling confused, trouble problem solving, some problems with memory, or you sort of misinterpreting, being hyperreactive and misinterpreting what people are saying. Behaviors can change if you see somebody or you see yourself taking risks that are unusual, disregarding our orders. You can hear the military language here, but disregarding norms, I would say, for healthcare, endangering others, using substances, and in some cases, just withdrawing, isolating, self-isolation, and others, conflict, engaging in conflict. There are kind of two types of reactions in a way. There's hyperreactivity. In the emotional zone, you might see anger, hostility, irritability, things like that. There's also hyporeactivity, which might include things like just withdrawal, deep sadness, and just feeling out of whack, completely unbalanced, feeling fearful, withdrawing into yourself. And of course, there are the physical signs of stress, which you can recognize in yourself. And we're used to doing that with rapid heart rate, elevated respiratory rate, maybe even fine tremor, muscle tension, and frequently somatic issues like headaches and GI symptoms, and lots of insomnia. That was reported a lot during the pandemic. So I thought we could take a little quick poll right now and ask you, where do you think you are on the stress continuum today? So I'm going to ask our webmaster there to launch the poll, and please just indicate on the poll where you think you are. And we'll wait a couple of minutes. So click in. We want you to engage here. I'm going to engage you in more discussion as we go. Are you thriving, green, reacting, yellow, struggling, orange, feeling unwell, red? No one can see these, so feel free to be honest. And where do you think we stand now? Can we look at the results? Thriving, reacting. Yeah, I would say this is really about par for what we've seen as we've done these polls around the country and with our members. Thank you for doing that. Let's go into the actual stress first aid framework. It is based on these 5 key factors that are evidence informed, and they actually emerged in a consensus statement of mental and public health experts and traumatologists, indicating that it's these 5 essential factors that are necessary to promote recovery from adversity and stress over the short and midterm occurrence of a major emergency or disaster. And these 5 factors include a sense of safety. Of course, that's at the bottom of the Maslow hierarchy of needs. You can't really get much else accomplished if you're feeling unsafe. So a sense of safety, the ability to calm yourself or to calm others, a sense of connection, as we've seen, self-efficacy, belief in your abilities to accomplish something you set out to do, and of course, hope. These are the 5 essential elements that also should be present in mass trauma interventions and interventions like stress first aid. I do want to make a point. This model, as I mentioned, was originally developed by the military. The National Center for PTSD has its own model. It's based on the same principles, those same 5 key factors or principles that I just mentioned, but they use different language to talk about the core actions and the key factors that they adapted for the military. Over time, since we've launched Stress First Aid, which is now 3+ years, we have found that our members relate more to the original language of the 5 key principles or key factors, we call them: safety, calm, connect, self-efficacy, hope. And there's fewer of them. It's a lot easier to remember. So we reverted back to the original language of the key factors, and that's what we stress. So our model has 2 core actions. I'll talk about the 5 original key factors. Each factor has multiple potential actions you can use to help yourself or to help others, to reach out to help others. Okay, so the core actions are simple: check and coordinate. So if you are a citizen of your organization, a member of the team, What this means is that you're looking, you're listening, you're observing. And if you hear something, you know what they say. If you hear something, do something or say something. But in this case, to somebody who looks excessively distressed or just plain old stress and you want to reach out, something as simple as, are you okay? Or you look stressed. What's happening? Can you tell me? Can I be of help? Coordinate reminds us that we really should be aware of at least two resources that we can access ourselves or offer to others, so that they can reach out and access those same resources within the organization. Coordinate, though, also means trying to understand now which of the key factors are most germane in the moment, because that's what's going to help you decide what to do next. In the next slides, you're going to see that we've listed a lot of potential actions for each of the 5 key factors, right? And we've listed them for both what you can do for yourself and what you can do for others. Often there's a lot of overlap. I'm not going to discuss each and every little bullet point here. You'll be able to refer to these slides later on. But for safety, this really means understanding and removing risks, seeking and sharing information, knowing what you need to do to keep yourself and others as safe as possible. For ourselves, knowing how to set boundaries, knowing what language is acceptable to the organization should there be a disruption from patients and families. We are seeing increasing levels of threat or threatening behaviors. So knowing how to de-escalate appropriately such behaviors, remembering to own the door. I know we've had Schwartz rounds actually where folks lost control of the door. They were stuck between a person who was frightening the healthcare worker, and they couldn't exit because the person was in the way of their exit. So remembering to own the door and how to call for help, all of this is super important. And if you're a supervisor, knowing how to deal with the situation, learning also how to steady yourself and to assume a calming, authoritative presence can actually help reduce a perception of threat, and it helps people calm down. Which brings us to the next key factor of calming. And of all the things that I think I use, this is probably the one I use the most. We talked about how the stress reactions activates the sympathetic nervous system. You notice your heart pounding, you notice your breathing, you may be sweating. There are lots of physiological techniques you can use to tamp down the sympathetic nervous system and that response. And again, you can practice, mindfulness-based breathing. Some people have learned and taught boxed breathing. This is actually taught to Navy SEALs, I've learned, where you inhale on the count of 4, you hold your breath for the count of 4, you exhale for the count of 4. And sometimes just pausing, just sitting down, stopping what you're doing is helpful. All of these can sort of suppress some of the sympathetic reactivity and allow the parasympathetic system to sort of come back online. And then there are longer term things that you can do, in terms of knowing what's in your control to change and accepting, at least temporarily, what you can't change, and reframing beliefs that, just aren't serving you. These are cognitive approaches that would happen not in the immediate of the situation, but a little bit later on. Same thing holds for other people as well, helping people to reframe their perceptions. I think the other thing that we see oftentimes, and I know I'm guilty of this, is using catastrophizing language. It's always like this. We're never going to get that. Instead of speaking or thinking like that, to really change your narrative, because it changes how you think. It changes your perceptions. So changing from never to at this time or lately, things like that. Sometimes this is happening, or lately it feels like this is occurring, and trying to really reframe for yourself and for others. You don't have to accept, everything that you think should be, is really in the way of your job and feeling well. It's not about acceptance. It's just knowing how to distinguish what's in your control in the moment, and then trying to figure out how to change in the long term, whatever is not. On to connection. So again, stress first aid is all about connecting with yourself through self-reflection and also with others. And we've talked about how important social connections are. For ourselves, this means reaching out to other people for support. Believe me, I know this is incredibly hard because we are taught to compartmentalize, to set our feelings aside, to soldier on, and I know that for me, the unspoken curriculum early on, when I was sort of training or growing up in medicine is you never ever show any signs of weakness. Because otherwise you may risk being overshadowed, overlooked, or, pushed aside. I think this is changing, but we still have a lot to do to reduce stigma around mental health and the need for help. So we need to actively model and promote the notion that, it's okay to say you're not okay. It's a sign that we're human and that sometimes we really need the help of others. So reach out for help from trusted mentors, from colleagues, and help other people do the same. If you become involved in stress first aid or you become a peer supporter, again, it's important to understand that your role is to listen with empathy, and if it's additional treatment or support is needed, to serve as that bridge to higher levels of care. Self-efficacy is your belief in your own abilities, and in self-efficacy as a factor in stress first aid is meant to help someone regain their belief in their ability to function in occupational, personal, and social roles. So sometimes this can mean retraining or upskilling, getting some mentoring. Sometimes it means reevaluating goals and expectations, whether for yourself or for others. All of these can be very helpful in recalibrating where you're at, where your team is at, where the organization is at. And so finally, we're on to the key factor of hope. And someone who could benefit from actions in this key factor, this person needs assurance that there's something positive, valuable, or meaningful that they can look forward to, that there is purpose and meaning to his or her life. It reminds me a little bit of trying to have goals of care conversations. You're always trying to understand what is meaningful to a person, and so how are you going to help them make decisions and support their sense that there is a sense of meaning and purpose and hope, whatever their situation is. So some of you may have these skills. The issue is to sort of turn them around to oneself and to others. It's a complicated issue, though. It really requires a lot of self-reflection and an informal conversation, to understand really the sources of helplessness or hopelessness and to understand what's meaningful to any given person. So also, as a peer supporter, if there are external resources that are needing whether those be financial, spiritual, or whatever, you can again serve as a bridge to that level of care. So we're going to take some time and discuss some cases. And I really hope that you guys will jump in and put some thoughts into the chat. So we have a bunch of cases, and I think we'll roll through these. What I'd like you to do is two things. Respond by saying in the chat, what do you think is the key factor that's most relevant here? And name one potential action that you could take. So here's case one. An ICU nurse is found trembling and hyperventilating after an attempted assault by a patient's family member. Clearly, she's experiencing, an acute stress reaction. Put into the chat, what's the key factor that you think would be most helpful upon observing this? And what's one thing you might be able to do? Think about it, jump in. You can see the key factors here: safety, calm, connect, self-efficacy, and hope. There we go. Thank you. Jump in. We want you to be active, because if you start working with these things, you'll start to realize how to use them, and it's the best way of incorporating them. What is the physical effect on her? How can I help? Yes. How are you feeling right now? What are you feeling in your body even? You know what? Redirecting someone's attention to the experiences, the somatic sensations, is also very grounding and can calm. Simone says safety and calm. Mary Johnson says safety. Yes. Jenna says calm. Yep. Offering words of support. How can I help you? Safety first. Laura, breathing, listening, empathy. Connect. Absolutely. I'm here, no, you're not alone right now. Safety, ensure she's safe. Do what you can to ensure safety. Jody, here's the thing that often there are multiple key factors, right? And you have to choose what to do in the moment, and then you're going to respond to whatever the person is saying. Connect to the staff. Sherry says, stay with the ICU nurse and reassure safety at the moment. Thank you, Sherry. That is absolutely really, really important. Connect, safety, help ground the nurse. Right. So you're pointing out all of these great ideas from potential actions that we could do. And I think they're all very, very germane. And you can see that, you're going to choose what's most apparent to you. Obviously, this is all, context dependent, but you're going to choose what you perceive to be most relevant. And then you can jump in, on what seems to be the best approach. How about this one? A clinician withdraws from colleagues, nurse, doctor, doesn't matter, and expresses tremendous guilt and self-doubt after making a medical error. What do you think would be helpful here? You're not trying to provide counseling or advice. You're trying to support this person who's expressing these guilty feelings and expressing, geez, maybe I should leave the field. Maybe I shouldn't continue on being, a healthcare provider. What might you do? Okay, so we're seeing empathy from Ginny, Janella, connect. Karen, self-advocacy, yes, because this person is not believing in him or herself. Hope, providing hope and providing connection. Any other ideas for this one? This is tough. Connection, self-efficacy, and hope. Right. And, other thoughts it might be, to help the person focus on how they've handled this in previous situations and what can they look back to that supports their sense that, yeah, you know what, everybody is human and sometimes it's the system that lines up the Swiss cheese model, and contributes to errors and mistakes. So it's not always the issue of being inept or incapable. Connect, self-efficacy, help remind them of the patients they've helped before. Yes, Simone, thank you. Connect with this is fabulous. Connect with another clinician who's been through similar experiences, was able to recover and stay in the field. That's extremely, extremely important and helpful. Thank you so much for this one. All right, let's see. We have some more, so let's go on to the next case. This is another kind of interesting case. And we are seeing this. There's a lot of turnover in senior leadership, particularly amongst organizations that are integrating or merging, being acquired, whatever. A senior leader whose position is unceremoniously eliminated after decades of service confides in friends about his anger and questions his purpose in life. What is the first thing you want to consider? What would you want to do with this person? And this could be interpreted in so many different ways, but let's see what you think. Anna says safety. Yeah, I'm wondering what you're thinking, Anna. You thinking this person is at risk, that they might be considering self-harm? Simone says express your gratitude. Anna says yes. Yes, I think that is a consideration too. This can be a sign that this person is more than just angry and questioning purpose. You want to make sure this person is grounded, is not having thoughts of self-harm. Validate the feelings, Laura. Thank you. And also try to redirect and reframe, bridge to more support. Absolutely. Hope for the future. Yeah, whoops, sorry about that. It's just suddenly rolled back up. Anna is saying, listen to their feelings. Yeah, just listen. Let that person just talk. Let that person express what it is they're experiencing, what their concerns are, what their worries are. Here's another one. Primary care clinician with young kids, school debt, very new, out of medical school and training. Feels unable to keep up with productivity demands and fears dismissal, and then starts really being hyperreactive, snapping at staff. I want to mention, Patricia, thank you for adding another comment to that previous one about the senior leader appreciation. Yeah, I mean, people, Reward and appreciation for all those words of service and dedication. Where did that go? It's really a hazard that things have become transactional instead of relational. It's a sadness. It makes you feel grief for all those who have worked so hard. So for this primary care clinician, we're seeing from Anna calm. What else? This person is really worried. He's or she afraid he's gonna be dismissed, terminated, and is hyperreacting, snapping at staff for little things. What else might you do? Calm, we have so far. Let's see if you can put out some more. Connect. Ask what would be helpful to reduce burden at home or at work. Yeah, interesting. Yeah, and there may be things through EAP, with resources for childcare, who knows? Or at least, a list of places you can look. And then again, trying to really dig into what is burdensome at work. And we know that so many people are looking at the electronic medical record and health record because there's so much there that adds to, pajama time at home, especially for primary care clinicians, that really reduce a sense of meaning, purpose, and not to mention time, at home with family. So asking what would be helpful, reducing administrative burden, what some people have called, there's in Hawaii, they started this initiative, said they call it get rid of stupid stuff. So they've actually had people set up working groups to, look at what is causing us the most time sink. And actually, many of the electronic health record companies can help you track that, and then bringing up what can be changed, what can be altered, what can be eliminated from the administrative burden of clinicians that really doesn't add to patient care or quality or outcomes. Reducing patient panel, if an option, perhaps they might take a hit on salary if they do that. Simone reminding them that they're human and just need to set realistic expectations with themselves. So, we're going into sort of two different kinds of areas, like what is it that you can actually do that might ameliorate this person's situation? And then how do you provide emotional, support? I love this saying, Laura, you can do it all, but not all at the same time, right? Can't be everywhere, everything everywhere all at once, right? Yeah, that doesn't work. Anything else that you can think of for this? All right. We actually have time for questions. And if you have cases that you would like to put into the chat, we have plenty of time for that as well. I really tried to leave a lot of time so you could input what you want to know more about. So feel free, do you have questions? And, are there cases that you would like to talk about? So feel free to put stuff into the chat. I also have just a couple. I'm going to do a quick recap in a sec, but I'd love to hear a little bit more from you. Yeah, I'll go to the next slide so I can remind you about some of these key pieces of the toolbox here, the stress continuum, and the 2 core actions, check and coordinate, and the 5 key factors: safety, calm, connect, self-efficacy, and hope. I will say too that many members and teams are using the stress continuum as a quick way to check in at the beginning of the day, morning huddles, team meetings, committee meetings. Where's the team on the stress continuum? Who is needing a little bit more support today? Many of these teams, amongst our members, some people will do this even more than once a day. So this is really caught on, and a lot of people are actually printing it out along with some reactions and potential actions, and putting them on the cards that you put on your lanyards, and using these to structure team meetings. So this has proven to be very, very helpful to people. Also, some people are posting it on screensavers or, in places where people can take a look at them. All right, so we have some stuff coming up in the chat. let's see, where is it? I just skipped right past it for some reason. Yes, you're going to be able to look at the, oh, I didn't mean to do that. Let's go back here. I think well, I know that this is being recorded and you'll be able to see this later on. Thank you. I'm glad you liked the session, Laura. Thank you. Recordings are present. Patricia's commenting that burnout is affecting all healthcare workers today. Yes, absolutely it is. And this is one really evidence-informed way you can address this. It's not the only thing. You know, we have to, and actually I will just tell you that the Schwartz Center has several culture change programs. I mean, I really think this is in a way a culture change program because it changes how we talk to each other and it normalizes something that is usually stigmatized. So it has the potential to change culture. And I think that we have other programs like that. Schwartz Rounds, for example, of course, is a potentially culture changing program because it brings people together to talk about their shared experiences and shared emotions and, you know, what's been helpful to them. We also have a new initiative called the Healing Healthcare Initiative, which is a program for senior leaders, clinical and executive leaders, based on some key principles that are also evidence and trauma and resilience informed. So thank you for that. It's incumbent on us to do whatever we can really to try to address the burnout and the stress that is happening all across the board. Also, moral injury is happening, and this is, you know, this has been talked about quite a bit too, where you know what the right thing is to do, but you can't do it, whether because of administrative constraints or administrative burden or regulations or whatever. So I want to read through some of these other comments. Remaining calm and prevent reacting to situations is important to do aggressive. It's so true. Also, it's catchy, Sherry. I don't know if you've observed that as well. But the more calm you can be or become, the more likely it is that others around you will sense that and remain calm as well. And that does decrease stress. How are stress and anxiety different? That's a really great question. I would say, and it has a complex answer, the way I sort of think about stress, and, you know, I'm not a psychiatrist, so don't hold me to the DSM definitions, but stress is sort of a physiologic, emotional, cognitive, you know, it's a multifaceted response. Anxiety has many of the same somatic physical representations. It's thought of more in terms of it as an affective disorder. And so that seems to be, you know, a driving piece of that definition for anxiety. You know, a psychiatrist might answer this differently. It's a great question, Sherry. Thank you. Oh, sorry. Keep scrolling here by mistake. Tom is saying that mental health is in the forefront today. What additional programs can healthcare offer their staff? So I was just talking about some of the ones that we offer. There's a lot going on. First of all, I'm going to mention a few things. Number one, National Academy of Medicine has a well-being collaborative on their website that it's really worth looking at. They have a lot of resources there. You can join the consortium, the collaborative, and they are issuing all kinds of recommendations, reports, and trying to sort of pull together some resources and evidence around workforce well-being. The Surgeon General's website is excellent. And that website really refers to the entire US population, but there's so much that's germane, and I love their infographic. So that is also the office of the Surgeon General. US Surgeon General is fantastic. The AMA has Steps Forward, which is also a really great resource of things that you can do to decrease burnout, improve efficiencies, reduce administrative burden. That's really been very helpful for people. We have our programs. We have, if you're a member of the Schwartz Center, you can you have access to Schwartz Rounds, to this program, Stress First Aid. We're just completing a pilot of the Healing Healthcare Initiative. Again, that's a senior leadership education and support program to really provide a trauma-informed and resilience-informed lens to implementing some of the key principles that really sustain or create cultures of organizational compassion. So that is another resource that will be available to Schwartz Center members later. As I say, we're doing the first cohort, so you'll have to stay tuned a little bit for that. And there are other things too that organizations can do. We're also we work with another collaborative that's really being hosted by the Lorna Breen Heroes Foundation, and they've been working very hard to change credentialing and licensure questions. Their feeling is that there is stigmatizing language on required applications for licensure for both nurses and physicians, probably for other professionals as well, but they're starting with nurses and physicians that require us to disclose whether or not we've ever sought mental health care. And those, unless those are causing current, present, situational impairment, those are, maybe considered inappropriate, invasive questions and potentially, violation of the American Disabilities Act. So they're working very hard to help people change those credentialing and licensure questions. So if you're a member of an organization, you can take a look at what you have to answer when you have to reapply to be credentialed. So those are just a few things that our people are doing. And I know that Kim put into the chat that MHA published a report on their Caring for the Caregiver initiative. It also has a lot of tremendous resources in it. And she's provided the link. Valerie, you're saying that yes, we have. So there's actually on the Lorna Breen website, you can see a map to show you which states have changed their requirements and which have not. And Massachusetts was the first in the nation to change those licensure and credentialing questions all across the board. So that is really pretty impressive. Let's see what else is in here. This is the Surgeon General's. Thank you for putting all those links in, Kim. I think you did that. Okay. Do we need to stop, Kim? Is that why you came in?
I think we are actually coming up on time.
Okay.
It's been wonderful, and I love all of the engagement in the chat. So thanks to everybody for that. Really, really great engaging program. Any final thoughts, Dr. Lone, before we?
I was gonna share this one incredible thing that I just love. I'm gonna show it to you. Don't take a minute. So,
Please.
walking through the New England Holocaust Memorial downtown, sort of near Government Center, it's an amazing memorial. And there's a quote there etched in the glass by a Holocaust survivor, Gerda Weissman. And she tells the story in her memoir about having a friend in the camp. I believe she was in Auschwitz. And this friend, Ilsa, she found, I don't know how, but she found a wild raspberry growing in the camps, kept it in her pocket all day to present to Gerda that evening when they were back in the barracks on a little leaf. And so Gerda's reflection was, imagine a world in which your entire possession is one raspberry and you give it to your friend. And I just love that as sort of a summary of stress first aid. We give ourselves in support of our friends, also our patients, their families. And it really is it's our calling, it's why we do what we do. So I just thought I'd share this just absolutely beautiful quote with you all. If you want to get in touch with me, feel free. This is my email, and you can also just try and get to me through the Schwartz Center's website as well. Thank you.
Wonderful. Thank you so much, Dr. Lone, for this great session today. I know I learned a lot, and I imagine a lot of the attendees will be taking information back to their organizations and thinking about how they can implement it with their own colleagues. So thank you for all of the participants for joining us today. And as put in the chat, recordings of this webinar and all of our Caring for the Caregiver series webinars can be found on MHA's Patient Care Link website. That link was put in the chat for you. So you can go there. This will probably be posted in the coming days. And additionally, you can scan the QR code on your screen now to see all of MHA's upcoming educational programming. We have a number of events this spring that we're looking forward to, and we hope to see you there at those. Have a wonderful afternoon, everyone. Thank you so much for being here today. And thanks again, Dr. Lone.
Thank you, Kim. Thanks for coming, everybody. Bye.
Take care. Bye.